This is Lila June. She's almost 1 year old. She was born on New Year's Day.
Starting a family is supposed to be a time full of happiness for many couples and mothers. But for some women, motherhood comes with challenges, like struggling with postpartum depression.
My therapist was like, I do think you have postpartum depression.
According to the CDC, 1 in 8 mothers are affected by postpartum depression, and many go undiagnosed. Experts say the COVID-19 pandemic has made it worse.
The pandemic has definitely played a role in the prevalence and incidence of postpartum depression.
I had it right away, and then it developed into postpartum depression. And who knows if it was just 2020 or if I would have had it anyways.
The Food and Drug Administration has approved a first-of-its-kind postpartum depression pill this past summer. It's called Zuranolone.
We have not been so successful in treating postpartum depression, despite it being very, very common now.
Symptoms of postpartum depression can include feelings of significant sadness, loss of interest, feeling guilty or worthless, which can progress into having thoughts of harming oneself or the new baby. And these symptoms usually begin 4 to 6 weeks after delivery, although they can start as late as 3 months after the baby arrives. The new FDA pill, which has shown promising results in studies, has patients seeing results after just 3 days. The only other option specifically for postpartum depression is an intravenous injection.
Zuranolone, the newer medication, which is the pill formulation, you only need to take once daily for 2 weeks. That's it.
But the convenience of a pill comes with a hefty price tag.
So one thing that might be prohibitive for many patients, unfortunately, is cost. They just released the pricing as well for the 14-day course of treatment with the pills, and the price is set at $15,900.
Kristen Gill, who is a psychiatrist, explained the price with insurance is still uncertain and that the cost will go down in general as time goes on. But some, like Amber, have struggled to even find a psychiatrist that they can afford.
Therapists and psychiatrists need to be more available to people who can't afford them.
It's one tool in a toolbox, and it should be used when appropriate.
Some moms are looking beyond traditional treatments and turning to a more holistic approach.
I was always a skeptical. My mom was a yoga teacher. I'm like, oh, Mom, I know you're teaching this, but the older you get, after you do have children, your whole perspective on life changes. And now you have this little person that you have to show up for and keep alive.
From therapy and support groups to meditation and yoga, the variety of treatment plans can fit just about any lifestyle.
And it's so important to take care of our mental health. You can literally just sit and be still and breathe, and it makes a huge difference in your day.
Now frame that right foot, draw that left foot in a few inches, folding over into parent fold.
A study done by the University of Colorado Boulder found that meditation outperformed medication in pregnant and postpartum women at risk of depression.
There is science backing the mindfulness and meditation.
Lauren and Tara led a mindfulness event to help teach moms techniques that they can use in their everyday lives.
Start to appreciate all of the beauty and blessings that are in your life.
And at Tara's yoga studio, Pause to Be Present, they have a 4-week series held from January to February, specifically for mothers of young children, to teach mindfulness techniques with guided meditation. Dealing with postpartum depression and parenting isn't easy, so finding what works best for you is key.
Whether it's through medication or therapy or peer support or any combination of the above, you deserve to feel better, and you are not alone.
I'm Isabella Leahy with the Columbia Journalism School.